Good day. I'm Nurse Lester, your clinical instructor for today, and I will give you pieces of information about placenta previa. So what is placenta previa? Placenta previa is a condition wherein placenta is implanted at the lower uterine segment near or over the internal cervical opening. The incidence of placenta previa is approximately 0.5% of births. The most important risk factors are previous cesarean birth, previous placenta previa, suction and curettage, and endometrial scarring. There are four classifications of placenta previa. First is the total previa, which is the placenta completely covers the internal cervical opening. The other is partial previa, in which the placenta covers the part of the internal cervical opening. Another is marginal previa, in which the edge of the placenta lies at the margin of the internal cervical OS and may be exposed during dilatation. And lastly, low-lying marginal placenta, in which the placenta is implanted in the lower uterine segment but does not reach to the internal OS of the cervix. There are 6 predisposing factors of placenta previa. Number 1, multiparity. 80% of affected clients are multiparent. Number 2, advanced maternal age, older than 35 years old in 30% of cases. Number 3, multiple gestation. Number 4, previous cesarean birth. Number 5, uterine incision. And lastly, prior placenta previa. Here are the clinical manifestations of placenta previa. Number 1, painless vaginal bleeding. Occurs after 20 weeks of gestation. Bright red in color, associated with the stretching and thinning of lower uterine segment. Another is adequately contract and stop blood flow from open vessels. Another is stop blood flow from open vessels. And lastly, decreasing urinary output. There are different diagnostic evaluations so that we can know if a client has placenta previa. Number 1 is transvaginal ultrasound. If a woman is bleeding, she is usually placed in the labor and birth unit or of cesarean birth because profound hemorrhage can occur during the examination. This type of vaginal examination known as the double setup procedure. Another diagnostic test is the ultrasonography. If ultrasonographic scanning reveals a normal implanted placenta, an examination may be performed to rule out local causes of bleeding and a coagulation profile is obtained. To rule out other causes of bleeding, management of placenta previa depends on the gestational age and condition of the fetus and the amount of cesarean birth. Here are medical management to do when a client has placenta previa. Number 1, maternal stabilization and fetal monitoring. Number 2, control of blood loss, if necessary, blood replacement. Number 3, delivery and viable neonate. Number 4, with fetus of less than 36 of gestation, careful observation to determine safety of continuing pregnancy are needed for preterm delivery. And hospitalization with complete bed rest until 36 weeks of gestation with complete placenta previa. Another is possible vaginal delivery with minimal bleeding or rapidly progressing labor. And that ends our discussion. I hope that you learned something on my video clip. For more information, visit placentaprevia.com. Thank you.